Good morning all. I'm Mr. Yohannah Dangyang. The topic I'm presenting is knowledge and practice of ethical and legal issues among doctors and nurses in Plateau State Specialist Hospital, Jos. It can come to our knowledge that we know that despite all that we've done in the health sector, we show that determinant of quality of care, one of the things that will give us is still the issue of ethical practice, moral behaviors. As you can see from the background, there have been big public concerns about moral behavior and conduct that we in the health profession portray to the public. There's growing complaints of poor ethical conduct, and this has led to a lot of losing procedures on nurses, doctors, and other health workers. It is in view of this that the researcher went further to ensure that he could see exactly what are the issues affecting the behavior of health workers, despite the fact that we are supposed to have adequate knowledge on ethics and legal issues. Methods. A cross-sectional survey was conducted among 89 nurses and doctors that are working in the study center, that's Plateau Specialist Hospital, after due consent was received, and it is to get information on the socio-demographic characteristics, knowledge of practice on ELI. The results obtained after the study are that the modeling group was 31 to 40 years. About 15% of participants were doctors. Majority, about 94.4%, have had about ethical legal issues. A greater number, 78.8%, indicated that we face legal and ethical problems daily. I don't know this thing. Can I have the screen widen a bit? Can I have the screen widen a bit? They have had about 40% indicated that they have not had enough training on ethical and legal issues. Lack of time, 68.5%, not having mentors, 82%, lack of knowledge, 75.3%, lack of awareness, 83.1%, and lack of motivation, 82%. We are not factors inflating proper ethical conduct and practice. There was no significant association between socio-demographic characteristics, knowledge and practice of the practitioners. It therefore shows that there is need for continued education on ethical and legal issues in the study center. However, we discovered in the introductory aspect that here we discover that there are many health challenges that we now face because of the complexity of care, and all this emanates from the fact that the public is getting more and more aware as a result of technology, as a result of sharing of media. The public becomes aware, and so they deserve more of quality care, respect, dignity, and so from the health workers. As we can see, despite the fact that we have some principles that have been enshrined into our curriculum to discuss about medical and nursing practice, like the Hippocratic Oath, the Nuremberg Code, the Lexis Declaration, etc., and other ethical committees that are set up in our various centers, yet we still continue to have a lot of ethical issues arising every day from our practices. Like in Nigeria, most of the daily reported ethical practices that come across are negligence of responsibility, delay and inappropriate reference, substandard or registered facility with inadequate trained personnel, incessant strike, because these strikes are the only thing that government knows. Some clinics act as if they are, some clinicians act as if they are education proof. Because of what is obtained, we discover that doctors and nurses do not believe that their misconduct, their act of unethical responses can lead to ethical legal proceedings. However, while we have the studies to visit our hospitals, we assess and we evaluate the knowledge and practices of our healthcare professionals in the aspect of ethical and legal issues, and to ensure conformity to recommended ethical conduct that have reduced in totality all that we do to assist our patients. The study was therefore designed to understudy the knowledge and practice of ethical and legal issues among doctors and nurses, to be specific. Methods of the study. We have the study site, which is Plateau State Specialist Hospital, a hospital that contains 9 wards, about 177 beds, 56 staff, doctors, nurses, student doctors that are being trained there. Population. The study population comprises of gave their written consent during the period of recruitment. Study design. Descriptive cross-sectional study was used. The period of study was 1 month. Sample size, all doctors and nurses that were present during the recruitment exercise. Sampling method is convenient sampling was used to carry out in all wards that permission were granted, and subsequently to all the doctors and nurses that were present that gave their consent during the recruitment period. Inclusion all doctors and nurses that were present. Exclusion all doctors and nurses that were not around during the period of recruitment. The instrument that was used is pre-tested self-administered questionnaire was used to obtain information from the participants on social demography. It was done in an English language, and the questionnaire was pre-tested in a separate hospital, that is Dangyang Comprehensive Health Center. Statement of confidentiality. All information gathered were kept highly confidential. Nothing in respect of how to trace any of the participants was kept. Data analysis. Data was entered and analyzed using SPSS 22.0. Descriptive statistics have been used to summarize the data, while chi-square was used to test. The association between categorical variables. The limitation. It is because of there's limited publications, less evidence about this, that we believe that this work should be accepted for further studies and should also form a ground or basis that we should be able to develop further studies on the needs to look into the ethical and legal issues in our hospitals. Many limitations at this time. All return questionnaires also affected the study. Ethical consideration. Ethical consideration was obtained from the ethical committee, determined mark after several consultations. Results. characteristics of the study population. 89% years out of 115 were returned. The mother group was 31 to 40. There were 84.3% and 15.7% nurses and doctors respectively. More than half of the respondents were female, and about 20% of them were Muslims, while the rest are Christians. As we can see, awareness of ethical and legal issues in medical care. Studies 89 respondents returned the questionnaires, making 86.4% of almost of them. 94.4% indicated that they have heard about ethical and legal issues. Ethical journals form about 28.1% and workshop conferences 27%. This signifies that the ethical journals and workshops and conferences form the bulk in which people got the knowledge about ethical issues, while the rest, books, media, textbooks, contributed a little. Affirmed that they face ethical problems daily in their work. One third stated that they were not aware of the existence of ethical committees within the confinement of their workplace, which is so surprising that even nurses and doctors do not know about the existence of ethical committees within their awareness. 72.9% asserted that the ethical committee were not fulfilling their roles. Well, then, on knowledge of ethical and legal issues, majority of respondents gave correct responses with regard to questions asserting their levels of knowledge. However, it was not worried that some of the participants were ignorant of the fact that a civil suit follows violation of ethical principles. 13%, 14.6% and that an illegal act is that which is against the law and is almost unethical. Only very few, 5.6%, failed to answer that at least 4 of the questions correctly out of the 8-point score that was made to ascertain their knowledge. 94.4% answered correctly with over 5 questions answered. I want to know how these things were going on. Practices and perceptions about ethical and legal issues in medical practice. Some issues that border on ethical and legal issues were discussed. Wow. Discussion. High level awareness in medical practice indicated knowledge of the existence of the ethical committee in the institution by some respondents. Same in the Caribbean also noted that some participants were not aware of the institution's ethical policy. Also noted that some participants were not aware of the institutional ethical review committee. Factors affecting adherence of practices. We discovered that the practice was affected by lack of awareness 74%, 83.1%, lack of motivation 82%, lack of mentorship 82%, and others followed. There was insufficient evidence to conclude that participants' level of knowledge of practice were influenced by socio-democratic characteristics. Gap in knowledge of basic ethical and legal issues of medical practice has led to argument. Should we disclose or should we not disclose to our relations issues on the health aspect of our children and patients or minors and patients? Refusal to participate for procedures by doctors and nurses, especially in abortion, where the law permits that we should be able to carry it. Conclusively, this study has shown that there are still gaps in knowledge and practice of ethical legal issues among nurses and doctors of Plateau State Specialist Hospital. The need for theoretical continuing education on ethical and legal issues In order to bridge the gap in ethical and legal issues present among healthcare professionals cannot be overemphasized. Rather, studies should be designed and carried out regularly to monitor, evaluate, knowledge and practice of ethical and legal practice among healthcare professionals. This will provide evidence-based information to correct and improve upon the knowledge and practice of medical ethics in our healthcare centers and ensure quality healthcare deliveries. These are the references, these are the tables that we can go through to ensure that I will hereby say thank you all for listening and for giving me the opportunity to present. Thank you.